Hello, my name is Dr. Pamela Fullerton, and I am the owner and clinical director of Advocacy and Education Consulting, a mental health organization dedicated to ensuring social justice through equitable access to mental health care. We are committed to supporting the immigrant communities experiencing injustice and hate in our nation currently. And today, with my wonderful team, we are here to discuss a very important topic, mental health, to ensure that you are all taking care of yourselves and each other during this difficult time.
Hi, my name is Samantha Rivera. I'm a licensed professional counselor and also a school counselor. And I know that during this time, I've seen firsthand all of the fear and anxiety, worries that are prevalent in our community. In particular, I know I've seen some students who haven't even felt comfortable coming to school out of fear of getting deported or a family member getting deported. There's been a high prevalence of ICE activity in different communities, and just even the hypervigilance around every time you leave your house, not knowing what could happen. And in addition to all of that, not knowing how to even prepare for the future, and not even knowing where you can go to access certain resources. So our goal today is that you know that you're not alone. And I wanted to pass it over to Javi to talk a little bit more about the mental health impacts and a culture of stress, how that could be exacerbated in this time.
Thanks, Sam. Hi, everyone. I'm Javier. I'm a graduate student therapist. A culture of stress, and we know for immigrants in general, um, is going to happen. That's part of the journey of the migration process. But particularly during this time when we've seen increase in hate crimes and violence against our communities, this fear and uncertainty is only going to exacerbate a lot of issues that they may have already come with, like along the way, the trauma that they faced. It's no wonder that immigrants and refugees are more likely to face particular mental health issues like PTSD than other groups. And particularly for those that were already involved in the education system here, um, the foreign-born youth often have an easier time acclimating to a new environment. So even in these scenarios, there can be a rupture from intergenerational rupture that can happen. Those that are fortunate enough to maintain contact with their family um, will still face these stress from a culture differences. So particularly now, we really want to be cognizant of who's in our classrooms, who is in our community that needs support, um, and giving yourself the opportunity to lend a hand if you're able to, because we know that from a social interest perspective, that also fills our cup.
Hi everyone, my name is Dr. Diana Gallardo. I am a licensed professional counselor and a full-time faculty at Northeastern Illinois University. And as my colleagues have been talking about community, right? And I think something that we wanted to also do with this is acknowledge and validate the current emotions that are being experienced, right? There's a lot going on in our communities. Many are facing difficult challenges and also may have more questions than answers, right? And I think that's why it's so important to remember that within community and family members and loved ones, you're not alone. In these times, it's also important to think about and also just normalize something that we've heard come up a lot in the past couple of weeks, months, includes this sense of frustration, fear, pain. Um, and also just wanting to get more answers to something that we don't have, right? But I've also heard a lot of support, a lot of love, a lot of comprehension, and a lot of empathy. There's this saying that says it's better to not give into fear because then it becomes real. And I want to challenge that a little bit by saying that it is important to talk about these things, as a way to seek community, right? And I think something that happens is, especially for immigrant populations, there's this idea that if you speak about it, it becomes true, right? But rather than taking it in that way, maybe talking about it to continue to seek support, and know that you're not alone, because most likely there's other people around you. They have those same fear, frustrations, and questions as we continue to navigate these challenging times. So this is just a reminder that you're not alone, and that these experiences and feelings are very real.
Hi, my name is Christina Fausto, and I'm a licensed clinical social worker, full-time clinical therapist here at Advocacy and Education Consulting. And I'd like just to lead us through some relaxation tools, little things that we can carry with ourselves, when we're on the go, something that just kind of sends that message to our brain of where we are in the current moment, grounding ourselves to the present moment, because it's very easy to get lost into the thoughts, into everything that's just kind of going around. And one of the first ways that we can do that is it's called 5-4-3-2-1. So really utilizing our senses, so I encourage you and looking around your environment and finding 5 things that you can see, and not the things that immediately stand out, but really trying to focus on maybe little details, little things that's on a dresser or somewhere that's hidden that isn't super obvious. And then number 4 is 4 things that we can feel. So if there's an object that we can grab and hold in our hand, and really just feeling the texture of it, the weight of it, or if we're sitting down, how does the seat feel beneath us, feeling our feet on the floor. Number 3 is 3 things that we can hear again, and really trying to fine tune things that aren't obvious sounds, listening outside. If we're in a closed room, what's going on outside our door? Number 2 is 2 things that we can smell. If we have lotion, if we have candles, if there's any oils, any sprays, something that we can smell. And then number 1 is 1 thing that we can taste. If we have a piece of gum, if there's a piece of candy, sometimes smells are so strong we can kind of taste it. So just really kind of imagining that. And that's the first step into being able to ground ourselves. Another one that I like to do too is, just very briefly, and being able to tense and relax muscles. So if you'd like to try, you can imagine that you have, a lime or a lemon in your hand, and squeezing it really tight and feeling that muscle tension in your arms, bringing your arm up like this so you can feel the muscles tensing, holding it for like 5 seconds and then releasing. And being able just to notice the difference of when our muscles are tightened versus when they're relaxed. And then repeating it on the other hand, again, just squeezing that lime, getting all the juice out for 5 seconds, and then releasing. And then the last little tool I'll give you today is, I like a color breathing. So if we're sitting down, if we're standing, wherever we are, just taking a couple of deep breaths, being aware, bringing our awareness to our breathing. And then as we're breathing in, we're visualizing a calming color, a soothing color, that as we're inhaling, that calming color is filling up our body and covering any of that stress and tension or anxiety that we're feeling. Whether we're noticing it start filling up from the head, working its way down to the toes, or whether we imagine the breath that's, hitting the back of our mouth and down our throat, past our lungs and into our stomach, and starting off as a ball of color, and then expanding the more that we breathe in. And then as we exhale, picking a color that represents that tension, that stress, that anxiety, and we're breathing out that color. So with each in-breath, each inhale, we're filling up with that calm, that soothing color, and all that stress and tension is leaving as we exhale. And you continue that for as long as you need until you notice all the stress and tension is gone.
Hello, everyone. I'm Dr. Kirsis Dupree, and I am a licensed professional counselor and a full-time faculty at Northeastern Illinois University. My job today is to kind of just echo what my colleagues have said, and also just give you a little bit more information around making sure that you have access to mental health services if the techniques and tricks that were shared already don't necessarily meet your needs. So the first thing I'm going to do is to talk a little bit about seeking mental health services if you have insurance. So these are just some tips and tricks to make the process easier. If you have insurance, the first thing you do is check your coverage. You could either review with your insurance by giving them a call, or if you have access to the online portal, you could review it in there, making sure that you're asking about what your coverage is for therapy services, either in person, telehealth, both. You may ask about psychiatric care if that's needed, medications. You can ask about deductibles, and just in general, any information that may be important for you, especially around finances. Um, the other thing is if your employer has employer assistance programs, they may offer short-term counseling services. And this is something most people are not highly aware of. So it's important for you to check that out if something that is important to you. And then lastly, just using national and local organizations related to mental health. A really big one is the National Alliance for Mental Illness, NAMI for short, and they provide guidance on how to access services in your area. Please check them out. They also offer resources in Spanish and other languages. Um, if you do not have insurance, for example, it does not mean that you can't access mental health services. So one important piece that I want to emphasize is thinking through community mental health centers. They offer many states, and they're state funded, may offer low cost or free mental services. The Chicago Department of Public Health, for example, provides behavioral health services at various locations. Please give them a look and check it out and see if that's available for you in your area. Another option is federally qualified health centers as well. And there's a website called findhealthcare.hrsa.gov that would give you more information, and it's really helpful for you. Additionally, university and training clinics, as we know, the Chicagoland area is highly populated with mental health services. And there's a lot of programs that you can take advantage of and reach out for low fees or even free services. You can also call if you are in crisis, a 988, sorry, for the Suicide and Crisis Lifeline, or in Spanish, you could also give them a call.
Hi, my name is Gabriela Brizuela, and I'll be talking a little bit about community. So why does community matter in a time like this? I think it's important to check in on ourselves, check in on our community, our neighbors, our family members, because it creates a sense of belongingness. You belong here. You feel less lonely. It leaves room for collaboration. And something that's very common among my clients and probably many of yours is that, where do I find community? What does community look like? Well, you can find community anywhere. You can find it amongst coworkers, amongst neighbors. Libraries often have a plethora of groups and activities that are free. There's meetups, online groups, and neighborhood groups as well. I find that community really helps us feel empowered. It makes us feel like, I mentioned earlier, like you belong here. There's a sense of belonging. It helps us unify towards like any difficult situation. There's power in numbers, and I just wanted to remind everyone of that.
Thank you so much, everybody, for joining us today. Please remember, you must take care of yourself and your community right now, but you are never alone in doing that. I hope you can use this information from today to support you during this difficult time. If you need additional resources, please, please, please reach out to us, and we can help in any way we can. Though we are located in Chicago, Illinois, we have resources all across the state and all across the 50 states. We can help you find something that you need, even if you're not local in our area. We wish you the best, and please take care of yourself right now.